What I'm about to tell you may completely change the way you look at the pain pills sitting in your kitchen right now. Because if you are over 65 and you take this pill even a few times a week, there is a chance it is doing far more than easing your back pain or calming your arthritis. It may be quietly pushing up your blood pressure, forcing your heart to work harder, causing fluid to build in your body, and in some people, increasing the risk of a heart attack, a stroke, or heart failure getting worse. And the most dangerous part is this. Most older adults never suspect it because this pill does not look dangerous. It looks ordinary. I'm Dr. Michael Joel, and today I need you to stay with me very carefully because the pill I'm talking about is one of the most common pain relievers in America. Millions of older adults take it without a second thought. Some buy it at Walmart. Some keep it next to the coffee maker. Some carry it in their purse or glove compartment. And many of them assume that if it is sold over the counter, it must be gentle, familiar, and safe. But that assumption is exactly what gets people into trouble. By the end of this video, you'll understand the 7 hidden ways this pill can damage the hearts of older adults, and why number 1 is the mistake that sends so many seniors into a spiral they never saw coming. Please subscribe today for simple senior health guidance, honest doctor explanations, and practical tips that protect your heart and independence. Before I reveal number 7, I need to tell you exactly what kind of pill I'm talking about, because this matters. I'm talking about common oral anti-inflammatory pain pills in the NSAID family, especially ibuprofen and similar pain relievers, and in some cases naproxen, diclofenac, and other related medications. These drugs can be helpful. They do reduce pain. They do reduce inflammation. And I am not telling you that every person over 65 must never take one again. That would be irresponsible. What I am telling you is that once you understand what these pills can do to an aging heart, you will never take them casually again. Let me start with Barbara because her story reveals hidden danger number 7, and it begins in the most innocent way imaginable. Barbara was 71, living in Sarasota, Florida, active, independent, proud that she still did her own gardening. One spring, her knees began aching after long afternoons, trimming hedges and carrying bags of mulch. Her daughter bought her a bottle of ibuprofen and told her it was the same thing everyone takes for aches and pains. Barbara started taking it most afternoons. Just a few pills here, a few pills there, nothing dramatic. And for the first week, she felt better. Less pain, more movement, more energy. She thought she had found a simple solution. Then something strange began to happen. Her blood pressure, which had been fairly controlled for years, started creeping upward, not exploding. Creeping. 132 over 78 became 146 over 84. Then 152 over 88. Then 158 over 90. Barbara thought it was stress. Maybe the heat. Maybe bad sleep. Maybe salty food. What she did not realize is that some NSAID pain pills can raise blood pressure by changing the way your kidneys handle salt and water, and by affecting the blood vessels that help regulate circulation. In plain English, the pill that was calming her knees was also making her cardiovascular system tighten up and hold on to more fluid. That is hidden danger number 7. This pill can quietly raise blood pressure. And for older adults, that is not a small issue. Because when you are 35, your heart and blood vessels often have more reserve. When you are 75, you may already have stiff arteries, diabetes, kidney strain, plaque buildup, or a history of hypertension. So a rise of even 5, 10, or 15 points is not just a number on a screen. It can be the difference between stable and unstable, between a manageable condition and a dangerous one, between getting through the month safely and ending up in an emergency room after a pounding headache or chest pressure that should never have happened. But Barbara's story gets worse because blood pressure is not the only thing this pill can disturb. 2 weeks later, she noticed her shoes felt tighter by evening. Then her rings became difficult to remove. Then she got winded walking from her mailbox back to her front door. Nothing dramatic at first, just little signals. And that leads to hidden danger number 6. This pill can cause your body to retain fluid. And when an older body starts holding extra fluid, your heart pays the price. More fluid means more volume inside the circulation. More volume means the heart has to push harder. That extra burden may not matter much to a perfectly healthy 25-year-old. It matters a great deal to a 71-year-old with aging arteries and a history of high blood pressure. I want you to picture what is happening inside the body, because once you understand the mechanism, you will never dismiss ankle swelling again. Your kidneys help decide how much salt and water your body keeps or releases. NSAID pain pills interfere with chemical signals that help keep blood flowing properly through the kidneys. When those signals are blocked, the kidneys may hold on to more sodium and more water. And now you're retaining fluid you should have gotten rid of. That fluid doesn't just sit harmlessly in the legs, it increases the workload on the heart, can worsen blood pressure, and in vulnerable seniors, can tip the body toward shortness of breath, congestion, and heart failure symptoms. Barbara wasn't imagining her swollen feet. She wasn't just getting older. She wasn't being lazy or out of shape. Her heart was being asked to carry a heavier load because of a pill she thought was routine. The moment her doctor reviewed everything she had been taking, including the over-the-counter medications she never thought to mention, the picture changed. They stopped the daily NSAID use, adjusted her plan, and within days, some of the swelling began to improve. That is why I tell seniors this all the time. The most dangerous medication is often not the one in the orange prescription bottle. It is the one you do not even think counts as medication. Now let's go to hidden danger number 5, because this is where the problem becomes even more serious. The heart and the kidneys are in constant conversation. When the kidneys struggle, the heart suffers. When the heart struggles, the kidneys suffer. And NSAID pain pills can put stress on that relationship. Let me tell you about Walter, 76, from Columbus, Ohio. Walter had a bad shoulder from years of home repair jobs and a stiff lower back that flared up every winter. He began taking naproxen almost daily because it seemed stronger and lasted longer. He felt fine at first. In fact, he thought he was doing better than before because he could sleep without pain. Then Walter started feeling more tired than usual. He wasn't urinating quite the same. His blood pressure was higher, his legs felt heavy. He assumed it was age. His doctor ordered blood work and found that his kidney function had worsened. And here is the part I need you to hear. When kidney function declines in an older adult, even modestly, the consequences ripple outward. The body may retain more fluid. Blood pressure may rise. Medications that once worked smoothly may stop working the same way. The heart has to deal with the aftershock. This is why a pain pill can become a heart story, even if it starts as a joint story. That is hidden danger number 5. This pill can strain the kidneys, and kidney strain can turn into heart strain. Seniors are especially vulnerable because many are already on blood pressure medications, water pills, diabetes medications, or heart medications that rely on stable kidney function. Add dehydration from a summer day, a stomach bug, not drinking enough water, or another prescription, and suddenly the margin of safety gets much smaller. This is not fear-mongering. This is physiology. Older adults have less room for medication mistakes, less room for hidden side effects, and much less room for self-medicating day after day without someone stepping back and looking at the full picture. But I haven't even told you the part that alarms cardiologists the most in certain patients. Hidden danger number 4 is this. If you already have heart disease or even silent risk factors for it, these pills deserve much more caution than most people realize. Let me tell you about Leonard, 68, from Mesa, Arizona. Leonard had high cholesterol, treated blood pressure, and a stent placed 6 years earlier after chest pain. He did what many men do. He moved on, felt better, and started thinking of heart disease as something that had happened in the past. So, when his hip started hurting, he grabbed the same pain pill he used before his procedure and took it for several weeks. He never imagined it could matter. Here's the problem. In people with known cardiovascular disease or people with risk factors like smoking history, diabetes, high blood pressure, prior stroke, prior heart attack, or clogged arteries, NSAID pain pills may carry a bigger cardiovascular concern than they do in healthier adults. Why? Because these drugs can tilt the body in the wrong direction at the wrong time. They may raise blood pressure. They may promote fluid retention. They may change the balance of certain clotting and vessel signals. And if you already have narrowed arteries, your system is less forgiving. The same pill that gives one person temporary pain relief can give another person a dangerous push toward a serious event. Leonard didn't have crushing pain. That's what fooled him. He just felt more winded on his driveway, a little pressure when climbing stairs, a little fatigue after lunch. He thought maybe he was getting older, maybe out of shape, maybe sleeping poorly. But his body was telling a different story. When he finally got evaluated, it became clear that his heart condition was no longer as stable as he assumed. Now, I am not telling you the pill alone caused every problem. Medicine is rarely that simple. But the pill added stress in exactly the places his body could least afford it. And that is what older adults need to understand. Risk is often about the wrong medication, meeting the wrong body at the wrong time. Now we move into hidden danger number 3, and for many seniors, this is the most surprising one of all. If you take low-dose aspirin because your doctor told you it helps protect your heart, certain pain pills may interfere with that protection. Let that sink in for a moment. You take one pill to help reduce clot risk, then you take another pill from the drugstore for arthritis, and the second one may get in the way of the first one doing its job properly. This is one of the most overlooked medication traps in older adults because both pills seem common, familiar, and unrelated. But inside the bloodstream, they are not unrelated at all. Let me tell you about James, a 73-year-old retired mail carrier from Tulsa, Oklahoma. James took low-dose aspirin every morning because of his history of coronary artery disease. He was disciplined. Pill organizer, same breakfast, same routine. Then his shoulder started bothering him after painting his garage. He began taking ibuprofen with lunch and sometimes again at dinner. He never mentioned it during his cardiology follow-up because, in his mind, over-the-counter pain relief did not belong in the same category as serious heart medication. That assumption nearly cost him. His doctor reviewed everything, spotted the interaction risk, and immediately changed the plan. Here's the simple version. Aspirin works in part by affecting platelets, the blood components involved in clotting. Some NSAID pain pills can compete in a way that may reduce aspirin's intended protective effect when taken too close together. And when you are over 65 with plaque already in the arteries, even a partial loss of protection is not something to shrug off. This is especially dangerous because seniors often take aspirin faithfully, believing they are doing everything right while also taking ibuprofen casually for pain. They don't realize those two habits may be working against each other. This is why medication timing, choice, and doctor communication matter so much after 65. And I need to pause here and say something very clearly. Do not use this video as a reason to stop any prescribed medication abruptly. Do not stop aspirin, blood pressure medicine, or pain treatment on your own because you felt scared during a YouTube video. That is not what good medicine looks like. Good medicine looks like informed caution, not panic. It looks like understanding which questions to ask. It looks like telling your doctor everything you take, including samples, vitamins, sleep aids, cold pills, pain pills, and supplements. Because when doctors do not know the full list, they cannot see the trap you may already be walking into. Now let's talk about hidden danger number 2, because this is where the ordinary pill becomes truly deceptive. The danger often doesn't come from one single dose. It comes from how easily one dose becomes a week becomes a month, and a month becomes a new routine. Let me tell you about Carol, 79, from Des Moines, Iowa. Carol took ibuprofen after a long car ride because her hips were aching. It helped, so she took it again the next morning, then again before church on Sunday, then again before grocery shopping, then again before bed. Within a few weeks, she wasn't using it occasionally anymore. She was depending on it to get through everyday life. That is the trap. Seniors rarely wake up and decide, I'm going to take a potentially heart-stressing medication every day. It happens gradually. The pill works, the pain returns, the pill works again. You begin planning your day around it. Then the dose creeps upward because the first amount doesn't feel quite as strong anymore. Then you add a nighttime cold medicine, not realizing it may also contain an NSAID. Then maybe a prescription, anti-inflammatory, enters the picture after a dentist visit or orthopedic appointment. And now you're not just taking one pill. You may be stacking similar drugs without realizing it. That is when risk begins to compound in a very quiet, very dangerous way. I have seen older adults do everything right with prescriptions and still get into trouble because of over-the-counter duplication. One bottle says Advil, another says a store brand, another says PM Relief, another is a sinus formula. Different labels, same medication family. The senior taking them does not see a pattern. The body does. The kidneys do. The blood pressure does. The heart does. And the emergency room eventually does. This is why I tell patients after 65, never assume two different packages mean two different risks. Read the active ingredient. If the print is too small, ask a pharmacist. The biggest medication error in seniors is often not carelessness. It is confusion disguised as convenience. But now we arrive at hidden danger number 1. This is the most common, the most dangerous, and the one I wish every older adult in America understood before their next trip to the drugstore. Hidden danger number 1 is taking this pill like it is harmless because it is over the counter. That is the real danger. Not just the chemical, the illusion, the false sense of safety, the belief that if no prescription was needed, no serious conversation is needed either. And that single belief is what causes seniors with heart disease, high blood pressure, swollen legs, kidney trouble, or aspirin use to self-medicate for weeks without ever alerting the clinician who could have stopped the problem early. Let me tell you about Nancy, 74, from Knoxville, Tennessee, because her story pulls everything together. Nancy had arthritis in both hands and a history of high blood pressure. She also took a water pill for swelling and a baby aspirin because of prior vascular disease. But in her mind, those were her real medications. The pain pills she bought herself were just helpers. She kept them in a cookie tin by the microwave. She used them before folding laundry, before long drives, before family visits, before sleep. She never listed them on her medication sheet because, she didn't think they counted. That one decision turned useful pain relief into a cardiovascular setup. Over time, Nancy gained 5 pounds of fluid weight without understanding why. Her blood pressure climbed. Her ankles swelled. She became more short of breath walking across her living room. Her primary care doctor increased one medication, then another, because the cause was still hidden. Finally, during a routine visit, a nurse asked one extra question. "What do you take that isn't on this list?" That was the moment everything changed. The daily NSAID use came to light. And once her team saw the full picture, the mystery was gone. The pill wasn't the only issue, but it was the missing link connecting the swelling, the pressure, the kidney stress, and the strain on her heart. This is why number 1 is so dangerous. It doesn't just cause a side effect. It hides itself from the medical story. It operates in the blind spot. Doctors can adjust prescriptions all day long, but if they don't know you're taking a common anti-inflammatory pain pill 4 times a week, they may be treating the consequences instead of removing the trigger. Seniors end up on more medications, more tests, more appointments, and more worry, when the original problem was sitting in a plastic bottle near the toaster oven. That is how older adults get pulled into a medical maze that never should have started. Not because anyone was foolish, because the warning never felt urgent enough. So, what should you watch for if you are over 65 and you've been taking these pain pills more often than you'd like to admit? I want you to listen to this carefully because your body often whispers before it screams. Watch for rising blood pressure, new ankle swelling, shoes feeling tight by evening, unexpected weight gain over a few days, shortness of breath when lying flat or walking to the mailbox, more fatigue than usual, chest pressure, a racing heartbeat, less urination, or the feeling that your usual heart or blood pressure medications suddenly are not working the same way. And if you notice slurred speech, one-sided weakness, chest pain, or sudden breathlessness, that is not wait-and-see territory. That is urgent medical territory. Now, there's something else older adults need to understand, and this part is critical. Not every pain problem requires an oral anti-inflammatory pill. That is one of the biggest myths in senior health. People assume pain equals pill, but often, especially after 65, the smarter question is not, what can I take? The smarter question is, what is safest for my whole body? Sometimes the answer may be heat, sometimes ice, sometimes physical therapy, sometimes a brace, sometimes a topical medication applied to the skin. Sometimes acetaminophen may be considered instead, though even that has limits and must be used correctly. The point is not that one option is perfect. The point is that the common pain pill is not automatically the best choice. If your pain is frequent enough that you need relief most days of the week, that is your signal that the situation deserves a real plan, not random self-treatment. Because once pain becomes routine, pill use becomes routine. And once pill use becomes routine in an older adult with cardiovascular risk, you are no longer in casual use territory. You are in risk management territory. That's when the conversation should shift from what helps today to what protects me 6 months from now. Seniors who ask that question early often avoid serious trouble. Seniors who don't ask it may feel fine for a while, right up until the day they realize their swelling, pressure, kidneys, or breathing have quietly changed. I also want to speak directly to the sons, daughters, and spouses watching this video, because you may be the only person who notices the pattern. Older adults often underreport pain pills because they don't want to complain, or they don't want to bother the doctor, or they're embarrassed they've been taking more than the label suggests, or they truly don't remember which days they took what. If you are helping a parent over 65, open the medicine cabinet. Check the nightstand, look in the purse, look in the car, read the labels. Over-the-counter does not mean invisible, and when you go to appointments, bring every bottle. The doctor can only protect the heart they understand. Now, let me give you the practical safety rules because information without action is not enough. Rule number 1. If you are over 65, never take a pain pill from the NSAID family for days or weeks in a row without your clinician knowing about it. Rule number 2. If you have heart disease, heart failure, high blood pressure, kidney disease, diabetes, prior stroke, prior heart attack, or you take low-dose aspirin, be especially cautious. Rule number 3. Never combine multiple cold, flu, sleep, or pain products without checking the active ingredients first. Rule number 4. If swelling, weight gain, or rising blood pressure begins after starting one of these pills, do not ignore that connection. Rule number 5. If you truly need one of these medications, the safest approach is usually the lowest effective dose for the shortest possible time, under guidance that takes your full history into account. Rule number 6. Stay hydrated unless your doctor has told you to restrict fluids, because dehydration can make medication stress worse. Rule number 7. Do not assume the absence of chest pain means your heart is unaffected. Older adults often present with quieter warning signs: fatigue, swelling, breathlessness, weakness, reduced exercise tolerance. The body after 65 does not always send dramatic signals. Sometimes it sends subtle ones, and those subtle ones are the ones people miss. I want to return for a moment to the phrase, "This pill is damaging the hearts of older adults," because I need to be precise. Not every older adult who takes an NSAID will suffer heart damage. That is not what I'm saying. What I am saying is that these pills can increase cardiovascular risk, can worsen blood pressure, can contribute to fluid retention, can strain kidneys, can interfere with aspirin in some situations, and can be especially problematic in vulnerable seniors. And when a risk is common, familiar, and hidden in plain sight, it deserves stronger language than people are used to hearing. That is why this conversation matters, because vague reassurance has already harmed too many people. Let me tell you about one more patient, because his story captures the emotional part of this that numbers never fully explain. Robert was 82 from Lexington, Kentucky, proud Marine veteran, sharp mind, neat yard. He hated depending on anyone. When his back pain flared, he took what helped and kept moving. He didn't want to sound old. He didn't want another doctor visit. Over several weeks, he became more fatigued. His daughter said he looked puffy in the face. He laughed it off. Then one morning, walking from the kitchen to the den, he had to stop and catch his breath. And that frightened him more than the pain ever had. What shook Robert wasn't just the symptom. It was the realization that the thing making him feel strong enough to stay independent had also been quietly undermining the very independence he was trying to protect. That is the irony older adults face all the time. The quick fix feels empowering in the moment, but if it pushes the heart, kidneys, or blood pressure in the wrong direction, the cost comes later. And later is when seniors pay the highest price. Later is when falls happen because of weakness. Later is when hospital visits happen. Later is when a person says, "If only I had known." My goal is to make sure you know before later arrives. And this brings us to the most important question of all. What should you do today after this video ends? Here is what I want. Go look at the bottles in your house. If you see ibuprofen, naproxen, diclofenac, meloxicam, or other anti-inflammatory pain pills, do not panic. Just become honest. Ask yourself how often you're really using them. Ask whether your doctor knows. Ask whether your blood pressure has crept upward. Ask whether your ankles are swelling. Ask whether you are also taking aspirin, a water pill, or blood pressure medicine. These are not dramatic questions. They are life-protecting questions. And the older you are, the more important they become. If the answer is, yes, I've been taking them more often than I thought, then your next step is simple. Write it down. Brand name, dose, how many times a week, and why you take it. Bring that list to your next appointment or call your clinician's office. That single act can prevent weeks of confusion and possibly something much worse. Seniors who take control of the full medication picture usually do better, not because aging gets easier, but because hidden risks stop being hidden. Clarity is protective, and in senior health, small moments of clarity can prevent very big consequences. Before we finish, I want to say one last thing to every older adult listening. You are not weak because you need pain relief. You are not careless because you trusted a common pill. You are not foolish because you assumed the drugstore shelf meant safety. These medications are everywhere. They are marketed as ordinary, and for many people, they do provide short-term help. The problem begins when aging, heart risk, kidney vulnerability, aspirin use, swelling, high blood pressure, and repeat dosing all meet in the same body. That body is often the body of a senior. That is why this message matters so much. Not to frighten you, to protect you. So remember the 7 hidden dangers. This pill can raise blood pressure, it can cause fluid retention, it can strain the kidneys and indirectly strain the heart. It can be riskier if you already have cardiovascular disease. It can interfere with aspirin in some situations. It becomes more dangerous with repeated or duplicated use. And most of all, it becomes truly hazardous when you treat it like it doesn't count. Because no prescription was required. That is the trap. That is the blind spot. That is what I never want happening to you or someone you love. If this video helped you, subscribe and share it with a parent, spouse, sibling, neighbor, or friend over 65. Because there is a very good chance someone you care about is taking this pill right now and has no idea their rising blood pressure, swelling feet, or shortness of breath may be connected to it. And once you see that connection, you can't unsee it. Protect your heart, protect your independence, ask better questions, bring every bottle to the next appointment, and I'll see you in the next video.